maybe this experience of really being confused or challenged or disturbed or out of balance is just a factor of being human in this remarkably challenging world that we're all trying to make, some difference in. We're all trying to find our way through in a sane way. And you and I both know that getting through a day these days actually takes a tremendous amount of effort and a tremendous amount of, blessing and even some fortune to get through just a normal day. So maybe there's nothing wrong with us, and maybe mental illness is really just a conversation whose time for transformation has come. Maybe it's time to start seeing that we're all having the same, challenges, obstacles, hurdles, and difficulties to try to get through this very, chaotic at times, and sometimes, very confusing and disturbing world that we're all trying to negotiate.
That makes a lot of sense. And I do think being the undoctor is it's a breath of fresh air, because we seem to live in times now where as quick as you can get an appointment here in the UK, it's quite difficult to get appointments. I don't know if that's the same way everywhere, but it's what you said. A lot of people feel if they get an appointment with a doctor, if they don't come away with a prescription, then it hasn't been a successful appointment. If they don't
Right.
come away with a diagnosis of something, it hasn't been successful. So what you're
Yeah.
saying makes so much sense. And it will be no surprise to you to know that um, I have had challenges with anxiety. I think you must be in the minority if you haven't. But thankfully, about 10 years ago, I was able to find a method that actually made me realize that this isn't something that you have to carry like a backpack, and you can
Right.
rationalize it. But you can't really, would you say in today's world, what you are doing is quite revolutionary, because a lot of people are almost offended if you say you don't have to define yourself as being an anxious person. You don't have to say, I have anxiety. It is part of me. It doesn't have to be that way. Is that
Right.
something that you find people almost push back on initially before they take what you're saying?
Absolutely. Yeah, people do push back. They really do want to be able to say, I have anxiety. I am an anxiety disorder. I am depressed. I have clinical depression. I am ADHD. I have I have attention deficit, or I have bipolar disorder, or I have autistic spectrum disorder, or I have there are so many disorders out there. It's hard to actually negotiate. The more psychiatrists you see, the more likely you are to have multiple diagnoses,
Yeah.
because the edges, again, for what it takes to actually meet the criteria for a diagnosis are blurred. And in fact, most clinicians don't use the actual DSM, the Diagnostic Statistical Manual, precisely enough to actually make sure you meet every criteria. And it's nebulous anyways. Even in its inception, it was nebulous in the beginning. So when you start reading this stuff, you start thinking that you're disordered. And the truth is, like I said, it's almost normal to think that you're abnormal. Like, it's part of being a normal human being is thinking that there's something wrong with you, that you're different, because we are comparing our insides with other people's outsides, and it's not a fair comparison. When I look at you, it seems to me that you have your world together, and if I'm confused today, I know, right?
Yeah.